We have a crisis with our health care in Louisiana that's offered by the state. The state, like most large employers, offers health insurance to its employees, its teachers, and its retirees. We call our plan OGB, the OGB health insurance plan. It's in trouble financially, and the reason is very, very simple. The state took the money. The state went in and took the money set aside for the health insurance plan. 2 years ago, we had $521 million, much of which is money of the employees and the retirees set aside to pay claims. To balance its budget, the state went in and took $270 million, and it continues to take money at the rate of $16 million a month. That's why we're having a fiscal crisis with our health insurance plan. The administration is proposing to right the ship, if you will, by offering new plans that basically ration care. They raise copays, they raise deductibles, they limit the doctors and the hospitals you can go to. They require prior authorization. This will shift about $190 million a year to the employees and the retirees and our teachers. I'll give you an example. One of the plans that they're pushing is called the Magnolia Local Plan in Baton Rouge. If state employees choose the Magnolia Local Plan, they can't go to Our Lady of the Lake Hospital in Baton Rouge. That's our major teaching hospital. They can't go to Oxnard. They can't go to Woman's Hospital. They can't go to Lane Memorial Hospital. They can only go to one hospital, Baton Rouge General. Now, Baton Rouge General is a good hospital, but employees need to know this. We need to slow this train down. The legislature needs to assert itself. The plan has to be adopted pursuant to the Administrative Procedure Act. The legislature, if it wants to, can exert its jurisdiction over that and critique the plan. Legislature needs to do that. Legislature also needs to get the legislative and auditor involved. He has an actuary on his staff, so it wouldn't cost us any money to check and double check and triple check the numbers. Look, I'll put my small government credentials up against anybody's. For years, I have talked about the need to reduce the size of the state workforce, and we've done that. But what they're proposing to do to our retirees and our school teachers and our employees is nothing short of unconscionable. And the way that they're rolling out these new plans, you can't get any information. It reminds me of when the Congress and the President rolled out Obamacare. It is a total mess. We can do better, and the taxpayers and the state employees deserve better.
And what do you think would be a good approach?
I think immediately the legislature should exert oversight and say under the APA, we have the right to review all new plans, and we're going to do that. We're going to go through those plans line by line. Number two, I would get the legislative auditor involved. The legislative auditor has an actuary who can check the numbers. The actuary that the administration's using is from out of state. I'm not saying they're wrong, but we should trust them, but we need to verify. The third thing we need to do is get the Legislative Fiscal Office involved. That is the nonpartisan financial arm of the legislature to study these plans. And then finally, and we're clearly going to have to make some changes, but finally we need to put together the information so the retirees and the employees and the teachers can really understand what they're being asked to spend their money on. Right now, all they're being given are a bunch of PowerPoints. There's no meat on the bone. I can't tell you the number of folks I've talked to who said, Kennedy, where's the beef? We want to know what hospital we can go to. We want to know whether we can still go to our doctor. We want to know if we get cancer, can we go to MD Anderson? We want to know if we need a heart transplant, can we go to Cleveland Clinic? We want to know how much it's going to cost. They're not getting those answers. We can do better.
And your reaction to the meeting at the Capitol?
Well, the meeting at the Capitol is not completely over yet, but so far I've heard just a bunch of bureaucrats talking about best practices and TPAs and utilizations, and I haven't heard anybody answer the question, which is the fundamental question of all this. What happened to the money? What happened to the money? Nobody wants to talk about the elephant in the room. I'll tell you what happened to the money. They took it. The state took the money that was set aside. A lot of that money was retiree money to pay health insurance claims, and they used it to balance the budget. Now, that's just a fact. The Legislative Fiscal Office has already done a study, and that was its conclusion. We need to learn from our mistakes, but you got to start by telling people the truth about what happened to the money, why we have this problem, and then we can talk about how we're going to fix it in a transparent, compassionate way.